Welcome to Mommy Heal Thyself. We feature guests who provide you with the tools, resources, and strategies you need to say no to a life of pain and suffering from all forms of preventable disease, toxic drugs, and unnecessary surgeries. We hope to inspire you to boldly reclaim your ability to heal and to serve the ones you love. Welcome, everyone. Today we have a fantastic guest with us, and we're going to be talking about something that a lot of you have been writing into me about, which is, Michelle, do you know of an alternative to health insurance? And I'm able to say today, ladies, yes, I have that alternative, because here today with us, we have Tim Hirsch, and he's going to be talking with us about New Health. Now, his story really starts a little bit back when he and his wife were facing significant challenges with their 6-year-old son, including anger and depression, and it proved ineffective and financially unviable despite seeking help from conventional healthcare, therapy, and medication. However, their lives improved when they discovered a functional medicine practitioner, and through various different therapies, dealing with their son's diet, incorporating brain chemical tests, incorporating supplements, they witnessed a remarkable improvement in his well-being. Now, this experience inspired him and his wife to adopt similar approaches with their own health. Yay! And they saw phenomenal improvements in their own health and well-being. So now, drawing back from 10 years of experience in assisting individuals with health insurance and recent collaboration with healthcare innovators and health insurance alternatives, he is inspired to concentrate on membership-based healthcare. This form of healthcare allows us to break free from insurance companies, yes, networks, claims, fillings, and take advantage of an alternative system that is based in community. You know, that is our theme over here. At New Health, they strive to support and guide families and parents grappling with inadequate healthcare system. Their goal is to provide their members with choices, yes, choices, and access to a program catering to their needs. They're committed to assisting alternative providers, functional medicine providers, naturopaths, direct primary care, and holistic providers, and their patients in achieving optimal health and well-being. So, Tim, welcome, welcome. We are so happy to have you here with us.
Thank you so much, Michelle. So happy to be here. Looking forward to this.
Yay. So let's begin at the very beginning by you telling us exactly what is New Health and how in the world do you make it so affordable?
Yeah, it's a great question to start with. It's kind of a loaded one in some ways, because in short, I mean, it's a simpler model to get healthcare. That's an alternative to traditional insurance. But I think the tricky part about it is that we all have such different experiences in our healthcare and what we think of as coverage or we think of as adequate coverage. So, it's taking a community approach, which I know is a great word for the audience here, and really having a community of like-minded individuals helping one another in our medical expenses, and then providing the support for our members as they navigate healthcare in a different manner. I think that's something that isn't lost on us and is an obvious thing in our current healthcare system is when you need something or you have a question, it's not always very easy to find the answer. So we want to be that resource in that community for our members as well.
Awesome. So now, how did you get started with New Health? How did you even think of such a thing to be available?
Oh, wow. Happenstance. It was actually for me, my journey to learning about medical cost sharing came about 7 years ago now at a church event. And someone came up on stage and I was helping people with, I was an insurance agent at the time, helping people find insurance plans and your traditional health insurance plans that most of us know and think that is how you basically have to consume healthcare.
Mhm.
And after hearing somebody come on stage and introduce one that was kind of a different type of medical cost sharing community, really religious based,
Yeah.
I dug in and I started learning. I felt like it was too good to be true. I felt that I would have known about this if it really existed because this was my life. This was my profession at the time.
Hmm.
And then as I started to uncover the stones, I realized, wow, this is a real amazing thing. And over the past, 4 or 5 years, maybe 6 years now, medical cost sharing has really evolved into a simpler model
Oh,
that's really forward thinking and preventive and what we call true preventive care,
yeah.
which is what New Health's all about and which really gravitated me towards New Health, just because they're not only doing something different in being a medical cost sharing community, but also differentiating in medical cost sharing by being niche of looking at alternative providers, functional medical providers, holistic,
Mm.
homeopathic,
So,
naturopath, whatever that, type of provider or clinician that you want to see is, we're a great complement to that type of system. And I think we're unique in that nature. So that's really where New Health, where I found a home with New Health anyways.
so tell us a little bit more about what makes New Health unique.
Yeah.
Because I've heard about religious cost sharing and things of that nature, and our audience, they're very much in tune with quote unquote alternative type providers, and that's what really drew me to New Health. So give us a little bit more in terms of that.
Yeah, that's great. And it's New Health is kind of this like system that all medical cost sharing communities do. We're a
Mm.
safeguard for unexpected medical events, which I
Yeah,
think is at the core what a lot of people come to us and initially say they want. I want to make sure that I don't need, lose my home because of a unexpected medical event.
yeah.
And at our core, we all do that. Now, we try to make it simpler in that we're all inclusive in that, it's great to be if you're Christian or Catholic or Jewish or whatever it happens to be, but that can sometimes be an obstacle to say, okay, now I have to find a community that's going to
Mm,
accept me only because I'm part of that
mm,
specific community.
mm,
And even the kind of hoops you sometimes need to jump through.
mm,
We might not want to get a letter signed by our pastor or fill out some of these applications that are like 15, 20 minutes or 15, 20 pages
mm,
long.
mm.
It just becomes kind of daunting. And I think we
Yeah.
all want this to be as simple as possible. And
Hmm.
New Health's niche is really from getting signed up, getting started, and even the understanding of it.
Hmm.
It's really a model that's consistent. It's not, hey, interchangeable to make it complex. It's, hey, this is what everyone gets. All our community is basically getting the exact same thing,
Hmm.
and it makes it just a simpler learning process too. And then the real thing that differentiates us is the way we approach preventive and wellness services.
Hmm.
I always find, Michelle, there's so many barriers in healthcare, except for the things that are standardized in insurance. Yeah, I know how to get a mammogram. I know how to get a colonoscopy. But how do I see a health coach? What do
Mm.
I do about supplements? What
Hmm.
do I do about preventive lab work? Because that isn't a preventive thing in
Yeah.
insurance. So it was taking those components of healthcare, especially because we know our members are seeing holistic providers. I'll kind of put them under that umbrella.
Hmm.
And there's usually a different path to treatment or
Yeah.
even uncovering. There's like a longer consult at the beginning that usually isn't covered by
Exactly.
insurance.
Exactly.
We will share in the cost of that, just like if they had a DO or an MD background, if they're a nurse practitioner who's functional medically certified, which was my clinician in the story you read at the beginning. And
Hmm.
those are great clinicians for me. They were a perfect fit. So we've taken those wellness services and
Hmm.
really put them at the fingertips of our members so they can easily use them. And you asked at the beginning, why is this so much more affordable? Well, we have this crazy idea that if we help our community become healthier, we'll have better healthcare outcomes and there'll be lower expenses for everyone. And it's proving to work, obviously, because we still have these lower costs and we haven't taken a increase to our prices in 4 years now, which is like
Wow.
unheard of. And
Exactly.
it's just through this concept of, wow, if we help our members stay healthy, give them the tools they need, this is going to work, and it's going to work for the community as a whole. Um, yeah, which has proven to be effective.
So now walk us through exactly how this works.
Mhm.
How does one get started? What is the process that you take people through?
So first, it's making sure that this is a good fit. So most people who contact us are learning about this for the first time and they just see the price. They're like, okay, it's half the cost of what I would be paying if I went the route I was going before in the traditional route. Cool.
Mm,
It's a great place to start. That makes it worth looking into. But we do have some differences from health insurance that we want to make sure that people are aware of. The
mhm,
real big one being that we don't share in the cost of pre existing conditions in the first year being with us.
mhm,
So someone said, hey, Tim, I just tore my ACL last month. I need to join New Health and get a surgery next month. Great. There's a system of health insurance that can do that, but that's not what
yeah,
we're designed to do. And part of why we can keep the costs down as a whole. So we want to make sure that they are a good fit for what we're trying to do. Because there's even others out there that pay $20 a month for their health insurance. They're getting financial assistance.
mhm,
At this time, they may not be a good fit. And we want to just make sure that they have a full scope and understanding because it's not just what you pay on a monthly basis. We try to look at your entire healthcare spending for the year.
mhm,
And again, we're making that a bigger picture than we're normally used to because we're helping you with supplements, lab work, health coaching, things that you might have just assumed you pay for on your own if you want to do, where, wow, this system actually helps support the costs around those things.
mm,
So it's looking at it from a picture of that point.
mhm,
And then really to get started, it's the easiest part. That's the part I love about it. There's no open enrollment, there's no long application, there's no qualifying. If you're under the age of 65, there's a couple states we're not available in, but almost anywhere in the US,
mhm,
you register. For me in New Hampshire, I'm registering the same as someone in New Mexico. There's no difference because we live in a different state. So you don't have to like, well, where do you live? It's going to be completely different there.
mhm,
And kind of the last part of it is what I truly enjoy the most, which was probably the most apprehensive part of joining and becoming a health share member. And I remember my wife specifically going to her first appointment and doing this and how like much anxiety she had about it was presenting as a self-pay patient versus using that card that we're so used to that think like we can only gain access to our doctor if they subscribe to this card and this network. And then
mhm,
I give them this card, and that's my get into care card. And basically, now it's clinician interacting or provider office interacting with insurance company to figure everything out.
mhm,
I have no say, I have no transparency. Now I'm a self pay patient. Saying I'm a self pay patient. I'm presenting that way. So I can now go to any clinician I want and know the new health membership is going to work just as it's supposed to. It doesn't matter if I'm in network, out of network. And then I get to see the bill. It's
mhm,
cool to be able to see a bill at the time of service instead of seeing it 2 months later and going,
mhm,
why did they charge me for that? And I think we've all been through that of
yeah,
why is that on my bill? Why I thought that was covered. I thought that wasn't covered. When you get the bill the day of, you can say, oh, if there's a discrepancy, you see it and you can have a conversation with the person there. So that part becomes very empowering that I
yeah.
mean, we truly enjoy that side of it versus, you know, we all experience just being in the dark. We're used to being in the dark with medical billing. Let's be real.
And it's scary because, as you said, weeks down the line, you get a bill and it's like, where did that come from? So I love the fact that you're empowering people to have those conversations up front with their providers instead of kind of wishing on a star that hopefully everything is going to work out financially. So that is fantastic. Now tell us a little bit more because I'm curious about the aspect of you said there's no such thing as in network or out of network, but
Mhm.
you're dealing with complementary providers, let's put it that way. So if I'm looking at someone who's like myself, I'm a natural health care provider and I
Mhm.
do mentorship and labs and interpretation and all that kind of stuff. Would someone be able to utilize the services of people like myself if they're within the new health program?
Yeah, and so this is kind of I guess, the meat of it where I think it's the beauty of this system.
Mhm,
It's not you, Michelle, as you're the provider, a relationship with New Health. It's your relationship with your patient.
mhm,
New Health is the patient's relation membership, and we are going to help with some of the cost, whether it's those labs. And
mhm,
you, as an alternative clinician, you've probably had to think this through, and you quite quite high likely have a way for your members to get labs affordably, because we know that's one of the marked up
That's the
like
best
most marked
way.
up things in healthcare. We
Absolutely.
also provide those resources, but they may decide to use yours, which are perfectly fine. But they can also apply their annual, we call it a physical or annual wellness visit, towards the visit with you instead of going to a MD and saying that's the only one it can be covered under. We
Wow.
try to take this word covered and just throw it away
Yeah.
because it
Mhm.
really it's the most misleading thing in healthcare. And say if you want to see Michelle and that's your annual physical, great. Pay for it with Michelle. She's going to give you a bill. You're going to submit that to us and we'll reimburse you up to $250 for that visit. And that's why I don't use covered, because I don't know if that's all the costs. It
Mm,
depends on how much Michelle bills or
exactly.
provider A, B, C, or D. But you know that we're going to be able to help with those costs where traditionally they're totally on their own.
Exactly.
Um, so there's that mechanism where it's like, yeah, you're going to have some out of pocket costs with
Mhm.
anything you do, but
Exactly.
ours are going to support a system that has totally been abandoned by traditional coverage and
Mm.
give you, some value there.
So within New Health, when someone comes in, um, they're made aware of what their allowances are, so to speak, for say labs or annual visit or anything of that nature.
Yep. And I'm trying not to get too specific because it's just there's so much that
Yeah,
we
there's so
really
much
do.
there. Yeah,
Exactly.
but everything is
But there,
upfront as opposed to surprise.
oh, definitely. So really, I describe it as we have two parts of our membership. There's the, hey, unexpected medical event happens again. Every health share does that in some capacity, but
Mhm.
yeah, you have a safeguard. Then the other half is just literally allowances, no cost services, discounts to preventive and wellness. I mean, we even started doing last month, we added into our membership a virtual fitness platform that
Wow.
includes nutrition planning. My
Nice.
wife and I have started using this where she's on a diet from a functional medical practitioner and it's
Mhm.
very specific. She can plug in all the foods she likes. It
Mhm.
provides us recipes so we
Mhm.
can be creative with our cooking. We don't have to be dull, and then
Yeah.
you can press a button. It actually gives you a shopping list to go to the grocery store.
Nice.
Like just little tools you might not even think of, but it's almost like an extension of her functional medical practitioner's like her plan. And it's able to support what we know that our members are going to go through in these
Mhm.
different ways that are just going to make it easier to stay healthy and kind of do what our clinicians are telling us to do, because sometimes that's the hardest part.
Yeah.
Great, I know I want to do what they told me to do, but how do I feasibly do it now?
Exactly, exactly. So now give me an idea of what is an IUA?
It's a very confusing term that is really simple. It's probably the best way to put it. It's really a substitute for a deductible, and it's just a little different where it's done on a per incident basis.
Mm,
The big thing that I used to find, and it used to just drive me crazy on behalf of the clients I meet with, most people meet their deductible about this time of the year,
ugh,
maybe December, and then it does what January 1st
starts all over again.
starts all over. And especially when we have something like serious, like a major treatment, a diagnosis,
Yeah.
this could go on for years where it's the same thing, but we have to meet a deductible every year. And these numbers aren't small. We're talking seven, eight, nine, $10,000. We're already paying an arm and a leg on the monthly cost.
Exactly.
So the IUA is advantageous because it never resets. We have members who have been in treatment for things like cancer for 2, 3 years. If
Mm,
they have the $500 IUA, they've met it once, and that is their only out of pocket responsibility for the entire time. But
wow.
thinking through it differently, it is a per incident basis. So if I break my leg, I pay that $500 for my broken leg and all the treatment, recovery, surgery, whatever might take place.
Hmm.
Then if one of my kids has an accident, they have to meet the IUA for that experience.
Mm,
And some people still look at it as the gotcha. Oh, I have to do it all these times. And I rhetorically say, how many times do we have unexpected major incidents? And they're like, oh, I've had one in the last 10 years. I'm like, that's why this makes sense for most people
yeah.
versus the model that we're just used to.
And the reality is that in our world today, most people are dealing with chronic health situations. It's not that gotcha kind of thing. So this would make even more sense because you're going to be dealing with, say, cancer for a long time. You're going to be dealing with diabetes for a while, so for you to be able to have just one initial uninsurable amount for that particular issue can be beneficial.
Yeah. And we have some savvy members too. So, avoiding the ER for like a strep throat and things like that. So we provide like our members telemedicine and ways to, kind of use the system efficiently. Because,
Exactly.
that commonly happens because when I have insurance, if I've met my deductible for the year, it's like, "Pff, let's abuse this now and just go wherever we're going to go and not kind of consume healthcare responsibly or efficiently."
Mm-hmm.
And that's a big part of our members, kind of that community approach. We're all pulling the same rope together. So let's do this effectively versus misusing the system.
And I think that is very important because I say to people that with health freedom comes responsibility, and when you become a responsible consumer, you start to think things through. I'll give an
Mhm.
example with your kids. If you take your kids shopping and they say, "Hey, Daddy, I want such and such," and if you say, "Well, sure, if you use your own money," they'll start to say, "Well, now
Yep.
that I think about it, I don't really need that." That's what I used to do with my kids. I would give them allowance and I'd say, "Sure, use your own money." Oh, that changed the conversation right away. They started to
Sure did.
reconsider everything.
We see that exact example when we say there's no networks. Now all of a sudden people are like, well, I'm used to someone telling me where to go. Okay, you have responsibility to now choose any doctor. So we help them through that,
Hmm.
tools like ZocDoc. I don't know if you've ever used that website.
Hmm.
There's all these different tools out there now to help people kind of through that. I have this responsibility now. What do I do?
Absolutely. This is just really exciting to me. So now, getting back to the money, because I know this is what people are going to ask me.
Mhm.
How do you determine the monthly amount, and what are some conceivable ranges that people can think about?
Yeah, that's an excellent question. It's as simple as it's the based off your age. So we do like age brackets. So for example, I'm in the 40 to 49 age bracket. So that'd be
Mm.
the one first determinant. Second's that IUA amount. So I can choose anywhere from a $500 IUA all the way up to a $5,000 IUA. Obviously, the higher IUA comes with a lower monthly cost because I have more out of pocket potential responsibility when that unexpected medical event happens. And the
Mhm.
other only other factor is the household size. So a
Mm.
single person versus a married couple versus a family, and it's unlimited kids on a family. So a family's a family, two parents, one or more children,
Okay.
and that bases your monthly rate. And the savings, I always try to take the savings a step further than
Mhm.
just the monthly cost, though. I
Mhm.
mean, it's hard. I mean, it's our initial reaction because for a lot of people, that's like close to their mortgage payment. And it's like,
Mhm.
great, we're going to reduce that. Probably on average, we're somewhere in the 40 to 50% range. So,
Hmm.
family paying 1,000 probably could conceivably think they're going to pay about 500 with us, depending on their IUA selection. But what we really often reduce, especially for the people that gravitate to us and the families that gravitate to us, is the out-of-pocket spending. A
Mm.
$500 IUA versus the eight, nine, $10,000 deductibles. If something does happen,
Yeah.
that's a significant difference. But for like me and my family, so we use full script for our dispensary, and we've been using
Mhm.
that for supplements
Yeah.
before. We offer a 35% discount.
Nice.
We spend a couple $100 a month in supplements. That starts to add up through the year. We can apply $250 to each one of our functional medical consults. We couldn't do that before. There's another $500. So it starts to reduce that overall spending for a lot of our members who just use services that they're not used to being covered. And now we're helping them with that financial impact.
So a quick question that came to mind.
Mhm.
Usually in the conventional insurance paradigm, your rates are also affected by things like whether or not you're a smoker, whether or not you're obese, whether or not you're diabetic, all of these things. Does that not factor into your computation? So I would be getting the same rate as somebody who's an obese smoker my age?
So tobacco is the one that we do factor, and it's pretty significant too. It is $112.50 more a month, and there's some limitations over the age of 50. We have very few tobacco users, and usually if they're over 50, I'm like, hey, there's some limitations. This may not be a good fit. I mean, ultimately it's their decision, but we want to make sure they're aware of that.
Mm-hmm.
But when it comes to like things we already have going on medically,
Mm-hmm.
sometimes it makes it, especially diet, if you're diabetic and you're type 1 and have all the requirements of all the equipment and testing you need,
Mm-hmm.
we're going to have a limitation to pre-existing conditions when they join. So we don't get too many type 1 diabetics
Mm-hmm.
versus someone who's type 2 taking metformin, very minimal, and supplementing through diet and exercise, where there's not really a potential for very high medical expenses.
Mm-hmm.
They typically end up just being a good fit and don't have that same limitation. But that pre-existing condition limitation for anyone with a chronic condition currently, it usually just makes us not a good fit. We don't want someone to join us and then get slapped with a big bill in the first year because we have that limitation. So we're going to make them very aware of that. So generally, we end up with a healthy community, and I'm very proud to say that we help improve that health too by giving them access to these simple things that we know are going to help health outcomes, making supplements more accessible and preventive labs and workouts, things of that
Mm-hmm.
nature.
So, what do you feel is one mistake that many people in general are making when they're thinking about health insurance in general?
Oh, there's so many. No, probably this, probably just status quo. This is what I'm used to. This is what I did. This is what my parents did. I'm not going to open my mind to something different. I'm going to keep doing what I do. When I hear someone say they're on Cobra and then they tell me they never use it and they're healthy, because Cobra is like even more because they left their job when self-employed, something of that nature, and
Mm-hmm.
they were just familiar with that health plan.
Yeah.
And we get them Cobra lasts 24 months. We'll get them at the end of that 24 months where they're like, okay, now I have to do something. I'm like, you were paying $2,500 a month that whole time and not using any. Yeah. And it's like, see, that's a
Buy a
mistake.
house.
Yeah, to me, I'm like, oh, that was a mistake. But at least we're here where we are now, where we can, save you 2,000 or close to that per month. Where, it's that comfortability and something that they relied on that they're not using.
Mm. But I love that you say that because a lot of times we don't know what we don't know. So I'm going to encourage all of you that are listening into this, click on the link in the show notes and just have a conversation. You don't know what you don't know. This may be the best thing for you. And as Tim says, it may not be a good fit, but at least enter into that conversation, enter into those possibilities of maybe there is another way. And maybe there's another way that will work better for me and for my family, you know. So, Tim, before we end, is there one last thing that you would like to share with our community that we should keep in mind?
Healthcare is simpler than it's led on to be
Mm,
to us if we just look at it through a different lens. And that's what I've probably uncovered over my 10 plus years in the healthcare industry over the past really 5 years, from direct primary care to health sharing to functional medicine.
mm,
It doesn't have to be as bad as we sometimes think it is. There is a better ecosystem and better system, as you said earlier to me, Michelle, running parallel to the one that we all think we're stuck in.
well, I want to thank you again for joining with us on this very important topic. And really and truly, this is just the beginning. I'm again impressing upon everyone that's listening to this. Please just start the conversation with your spouse, with your other family members, maybe your parents, start that conversation about healthcare because this is one of the number one things that bankrupts people in our nation today, healthcare costs. And as Tim was sharing with us, when you pay for things with cash, you'd be surprised how those costs come down. When you become empowered to be able to know what your choices are, know what your options are, you would be amazed that it is not as complicated as they want you to think it is. So remember, you have the power. Until next time, my ladies, I wish you peace and blessings. Thank you for tuning in for this episode of Mommy Heal Thyself. If you like what we're doing here, please share, subscribe, like us, and leave a comment. Your feedback is very